The first doses of Pfizer's coronavirus vaccine are heading to hospitals across the United States. It's an historic moment in the fight against COVID, potentially the beginning of the end. And tomorrow, vaccinations will start. Some frontline healthcare workers in Central Texas will receive the first of 2 shots early this week, followed by other priority groups. The CDC director accepted the recommendation that the Pfizer vaccine can be given to people 16 and older. Now, so far, only children 12 and older have been included in the trials, but studies are planned for younger children. As KXAN investigator Arezow Doost explains, pediatricians in Texas are hopeful that a vaccine for all kids could be ready by this summer.
Nature walks, a socially distanced fishing outing, and lots of baking. It's how Sarah Bond's family has spent the last 9 months.
We don't go grocery shopping. I haven't had a haircut in way too long.
Sarah's 2 boys, 10 and 12 years old, are virtual learners. Anytime the family from Austin does anything outside their home, they weigh the risks.
We have a pod mate for each friend that they get to see in person without a mask. That's all of the risk. We spend it all on our children's pods.
Sarah is a midwife and has traveled the world working in pandemic hotspots. She's now the co-founder of Waking Giants, a company which provides education and products about social inequities, most recently COVID-19. Will the kids get the COVID vaccine if it's safe and effective?
The moment that we are cleared to get it, we absolutely will. And then we are going into the world. I can't wait.
The Texas Pediatric Society, which is a local chapter of the American Academy of Pediatrics, says it could be months before they know more about the impact of the vaccine in younger kids.
We really don't have that data yet.
Pfizer is testing the coronavirus vaccine in children 12 and older. A spokesperson says to include younger kids, an additional clinical trial would be required, and the company may have to consider a lower dose of the vaccine. Moderna just started testing the vaccine in teenagers. The company's goal is to have data by the spring. Younger children are expected to be tested early in the new year. AstraZeneca says further studies are planned in children.
As part of the determinations of whether a vaccine is going to work and whether a vaccine is safe, they have to have at least 2 months worth of data on a given group. The hope is that there is a very, very important timeline to try to get this done by, and that is the start of the next school year.
Pediatrician Dr. Seth Kaplan says as safety data will be analyzed, he wants to learn more about the impact of the vaccine and a rare illness called multisystem inflammatory syndrome in children, or MISC.
It's a very, very small number of children who've had COVID who go on to develop that condition. And so there are some legitimate concerns that if kids are vaccinated, could the same thing happen from them being vaccinated? And we don't have the answers to that yet.
Sarah says her family is waiting for more data too, and trying to be realistic.
We signed all our kids up for camps this summer, some sort of like magical thinking that maybe it'll be okay, but I just can't imagine that it is.
She's hopeful next holidays will at least look different. Arezow Doost, KXAN investigates.
And Dr. Kaplan tells Arezow that a number of 16 to 17-year-olds were included in the Pfizer vaccine trials. He says concerns were raised that they were in essential fields like the grocery stores, so they're at an elevated risk, and that's why the age group was lowered from 18. He also says medical providers will need to work on messaging about the safety of the vaccine once it's available to children. He says Texas has a higher rate of vaccine hesitancy, even when it comes to the vaccines already available. The state health department says Texas schools reported high rates of vaccination during this last school year, but the records do not include homeschooled children.